My name is Mollie Sullivan and this is my competency video. Is it okay if I begin the exam?
Yes.
Okay. I'm going to begin by just inspecting your scalp. Any lumps, bumps, bruises, trauma, any lice or issues. Good. I'm going to palpate your temporal pulses. Good. And then I'm going to check your cranial nerves. If you could please raise your eyebrows. Squeeze your eyes nice and tight. Give me a smile with your teeth. Show me a frown. Good. Stick out your tongue. Good. You can puff out your cheeks and I'll push on them. Good. Then I'm going to check the outer structures of your eyes. So if I could just have you look forward, I'm just going to start by pulling your lower lid down. I'm going to assess your subconjunctiva, checking for your cornea. Your eyelashes look nice and healthy. Go ahead and look up, look down, look left, and look right. Good. Next, I'm going to check your extraocular motors. So just looking forward at my finger without moving your head, just follow with your eyes. Look up. Good. Good. And then I'm going to just check for convergence. Good. At this point, I would dim the lights. Now I'm just going to take a look at your pupils and make sure that they are dilating to light. So if you just look straight ahead at that wall for me. Good. Just gonna shine a nice bright light, okay? Good. And I'm gonna look for accommodation in the other eye. Good. And on this side. Forward. Good. And then accommodation in that right eye. Good. Now I'm going to check the back structures of your eye. So again, just having you look forward for me. I am going to come from the right. Good. I do apologize, it's going to be a flash of bright light. Looking for that red light reflex. Good. Coming in for the disc in the cup. And then the macula and the fovea. Good. And then on this side, again, pulling that eyelid up slightly. Good. Red light reflex. Disc in the cup. And the macula and the fovea. Good. Now I'm going to take the cotton whisk. Go ahead and close your eyes for me, and when you feel it touch your face, please say now.
Now. Now. Now. Now.
Good. Now I'm just going to inspect the outer structures of your ears, looking for any trauma, bruising, swelling, drainage. Do you feel any pain when I pull on your pinna?
Nope.
Good. I'm going to say 3 words to you. If you could repeat them back to me.
Fisher. Rochester. New York.
Good. And then on this side.
Dog. Overwood. Gunner.
Now I'm going to take a look inside of your ear. I'm going to inspect for any obstructions or excessive cerumen, which is earwax. Good. Okay. I'm going to pull your ear out and up. Good. Good look. Assessing that your eardrum is nice and pearly gray, which it is. Coming on this side, same thing. Out, back, and up. Good. Now I'm going to inspect, well, come on this side. Now I'm going to inspect the outer structures of your nose, making sure that it is straight, there's no bruising, no swelling, no trauma or issues. Go ahead and take a nice deep breath in through your nose. Good, and again on this side. Good. Now I'm just going to take a look inside of your nose. I'm going to look for any polyps or looking at your turbinates or any obstructions. Good. Good. Sorry. Next, I'm going to take a look inside of your mouth. Just going to inspect your lips, making sure they're not dry or cracked. Checking your buccal mucosa. Good. Making sure no broken or missing teeth. Good. Go ahead and stick your tongue up. Looking for any lesions. Good. And at this point, I would gag him. Okay. Now I'm going to assess your neck. I'm going to make sure that your trachea is midline, that I don't feel any abnormalities such as lumps or bumps, any bruising or signs of trauma. And then I'm going to palpate your lymph nodes now. So I'm going to feel your preauricle, your postauricle, your posterior occipital, your posterior cervical, your supraclavicular, which I do not feel a Virchow's node. Good. Your submandibular, your submental, and then your anterior cervical. Good. And then I did forget to check your temporomandibular joint. So I'm just going to feel right here in your mandible muscle and then have you open and close your mouth repeatedly for me. Feeling for any clicks? Are you having any pain?
Nope.
Good. Now I am going to have you shrug your shoulders up against your resistance. Good. Okay. Next I'm going to check your thyroid. So I'm going to come from the back. Have you take this glass of water. Please take a sip and hold it in your mouth. Do not swallow until I tell you to, please. So coming from the posterior approach, I'm going to feel for your thyroid. Good. I'm going to have you tilt your head down and then to the right. Go ahead and take a nice big sip. Good. If you could do the same, we're going to go to the left this time and swallow. Good. And then again, I should have done this before I had you swallow. I'm going to assess your thyroid, looking for any goiters or enlargements or abnormalities. Good. Next, I'm going to assess your respiratory system. If you could please remove your shirt. Good. On this side. I'm going to begin the assessment by just taking a look at your chest and inspecting for any lumps, bumps, bruises, trauma, abnormalities. Good. I am going to start by just percussing your chest. Good. And I'm just going to do the same on your backside. Now I'm just going to take a listen to your lungs. Every time that you feel my stethoscope move, take a nice deep breath in with your mouth. And one more time on the front. Okay. I'm going to do the same on your backside, okay? And same again, just take a nice deep breath in with your mouth anytime you feel the stethoscope move. 2 more times. And then 1 more time. Good. Next, I am going to assess your cardiovascular system. So I am going to start just by palpating your carotid arteries one at a time. Start with the right. And then the left. Good. I'm just going to take a listen to them with the ball side of my stethoscope. Take a nice deep breath in and hold it at the top, please. Good. We're going to do the same on the other side. Nice deep breath in and hold. Good. Now I'm going to have you just lean forward. I'm just assessing for any pulsations or heaves. Good, which I do not see. You can go ahead and step forward. Now I'm just going to listen to your heart with both sides of my stethoscope. You can breathe normal. And then again with the other side. And then I am going to have you just lie flat on your back. It's pillow on my, okay. And I'm just going to do the same. Listen to your heart with both sides of my stethoscope. Again, you can just breathe normally, okay? And then again with the other side. Good. Now I am, I guess I'll stand on this side. Now I am going to check your abdomen. Actually, Aurora's on this side. Can you just scooch this way a little bit? But like, don't hit your head.
Mm-hmm.
Thank you. Okay. Next, I'm going to check your gastrointestinal. If you could just relax your hands down to your sides for me. I'm just going to start by inspecting your abdomen for any bruising, signs of trauma, swelling, abnormalities. Good. I'm going to listen to your stomach. Now I am just going to percuss your stomach. Now I'm just going to feel for the border of your liver. So again, I'm just gonna palpate up. Good. Go ahead and take a nice deep breath in for me. Good, I'm just gonna feel for your liver border. Good, any pain with that? No? Good, okay, you can relax. Now I'm just going to palpate your abdomen. So I'm gonna start with light palpation and then deeper palpation. Just let me know if you have any pain or tenderness. A little bit on the lighter first. Any pain so far? Good. Good. Now I'm going to do deeper palpation. No discomfort, correct? Good. Good. Okay. Now I'm going to do your peripheral vascular system. Okay, you're not gonna move. Okay. I need you to move. Okay. So I'm gonna do your peripheral vascular system. I'm just gonna start by inspecting your arms for any discoloration, making sure that your color is even. You're not extra pale or any bruising. Good, I'm gonna feel for temperature. Good, and then I am gonna feel your brachial pulses. Good, and then your radial pulses. Come on, side. Good, I'm gonna check your capillary refill, and that is less than 30 seconds, which is what we want. Good. And then I'm gonna do the same on your legs. If you could please uncross them. You can just relax them though. Again, assessing for color, for temperature, making sure they're even, not too warm, not too cold. Good. I am going to check for any edema. Good. And then I'm going to check your femoral pulses. Good. And then I'm just going to bend your knee up at a 30-degree angle. Good. And then your other leg. Good. And I'm going to check your cap refill, which is less than 3 seconds. Again, what we want. Good. Okay. You can sit up now. So now I am going to check your neurologic function. So I'm just going to start by assessing your sensory function. If you could please relax your hands on your legs. Just close your eyes for me. When you feel it touch a certain part of your body, please tell me what part it is.
Left hand. Right hand. Right foot. Left foot.
Good. Thank you. Now I'm going to check your deep tendon reflexes. So I'm going to start with your, I'm going to start with your tricep reflex. So I'm going to hold your arm up and then I'll support it. If you can just try and dangle it, relax your hand. Good. I feel for the V. Try with the other hand. Relax. And then on the other arm, again, if you can just try and relax. I'm going to check your bicep. So if you just try and relax. My hand's not big enough. Like her. Good. And then again on this side, try and relax. Good. Okay. Now I'm going to check your radial tendon. Just try loosen. Perfect, just like that. If you don't mind, I'm just gonna take that off. Thank you. Okay, relax. So 2 finger breaths right above it. Good. You can put that back on if you'd like. And then on this side again, yep, perfect, just like that. Good. Okay. Yeah, you can fix that. Sorry. Next, I'm going to check your patellar tendons. If you can just scooch back a tiny bit. Yeah. Yep. And then what I'm gonna have you do is take your hands like this and just pull them apart as hard as you can. Good. Ready? Perfect. Good reflex. Okay, and again. Good. You can relax. Okay. And then I'm going to check your Achilles tendon. Good. So just try and relax your foot. I'm going to support the ball of your foot, looking for a plantar flexion. Perfect. Good. And again. Good. Okay, now I'm just going to check your Babinski reflex. So again, if you could just angle your feet. I'm just going to take this and scrape it against the bottom of your foot. Good. Now I'm just going to assess your musculoskeletal system. If you could please stand up. I'm going to have you face that way. I'm just going to make sure you're in the camera. Okay. Good. Okay, if you could please just bend forward like you're diving into water. I'm just assessing that your spine is nice and straight. Good. If you could please stand up and then face me. Put your hands on your hips just like me. And then go ahead and turn to each side. Showing a nice twisting motion, assessing your range of motion. And then a tilt to one side. Good. And a tilt to the other. Good. Any pain with that?
Nope.
Good. Okay. And that is my competency video.